Ever heard of an illness so sneaky? It can make you feel like you have pneumonia, but you're still well enough to go about your day.
It's a bit of a medical
It
mystery.
is.
Eh,
It really is. That's atypical pneumonia for you,
Yeah.
often called walking pneumonia. And today, we're going to take a deep dive into its history, from its mysterious origins.
To how it's treated today,
Yeah,
it's a fascinating journey of medical discovery.
it really is.
And that name, walking pneumonia,
It's so interesting.
it really is apt, wouldn't you say? It hints at those often milder symptoms
For sure.
compared to what we typically associate with.
With the word pneumonia.
Yeah, pneumonia.
Exactly. With typical pneumonia, we think of being really sick, high fever, struggling to breathe, the whole 9 yards. You'd probably be in the hospital.
Right.
But with atypical pneumonia, someone could be walking around with a lung infection and not even realize how serious it is. So before we get into the atypical, let's just touch on typical pneumonia, just to set the stage.
Good point. Typical pneumonia is usually caused by bacteria like Streptococcus pneumonia. It tends to hit hard and fast,
Yeah.
causing those severe symptoms you just mentioned.
Okay, so that's our baseline. Now, the real mystery begins with atypical pneumonia. We know now it's caused by a different group of suspects, including bacteria like Mycoplasma pneumonia, chlamydia pneumonia,
Right.
and even some that can lurk in water, like Legionella pneumophila. Uncovering these culprits was quite a challenge for scientists back in the day.
Absolutely.
I mean, can you imagine?
Yeah, imagine being a doctor in the 1930s,
Yeah.
seeing patients with these pneumonia-like symptoms,
Yeah.
but the usual treatments,
Including penicillin.
including penicillin, the wonder drug at the time,
Yeah.
just weren't working.
Not working at all.
It was a real head scratcher.
So frustrating. For both doctors and patients, what were the early theories about what could even be causing this strange form of pneumonia?
There was a lot of confusion
I bet.
initially. Some scientists even thought it might be a virus. Because the causative agents were so small, they couldn't even be seen under a regular microscope, let alone grown in a lab. And this really challenged the existing knowledge about pneumonia at the time.
Like trying to solve a puzzle with missing pieces.
Yeah.
So how did scientists finally start to piece together this medical mystery?
Well, the breakthrough came
Oh, tell me.
in 1944 when a scientist named Monroe Eaton,
Okay.
after years of painstaking research,
Okay.
finally managed to isolate the elusive culprit from infected patients. He called it Eaton's agent.
Eaton's agent. It sounds almost like a code name from a spy movie.
It does, doesn't it?
It does.
But this Eaton's agent didn't fit neatly into the categories of bacteria or viruses known at the time.
Right?
It turned out to be a type of bacteria called Mycoplasma pneumonia.
Okay.
And that discovery,
Look, is huge.
it was a game changer.
So what was so unique about Mycoplasma pneumonia that made it so difficult to figure out?
Well, unlike most bacteria, Mycoplasma pneumonia lacks a cell wall. Think of it as a knight without armor. It's more vulnerable to certain attacks, but also harder to target with conventional weapons. That's why penicillin, which works by disrupting bacterial cell walls, was ineffective against it.
So that explains why the usual treatments were falling short.
Yes.
Mycoplasma pneumonia was finally unmasked.
As a major player in atypical pneumonia, especially in younger adults.
Right.
But was it the only one?
While Mycoplasma pneumonia was a significant discovery, it wasn't acting alone. In the 1950s and 1970s, two more culprits were added to the atypical pneumonia lineup: chlamydia pneumonia and Legionella pneumophila.
Wait, Legionella, isn't that the bacteria responsible for Legionnaire's disease? That
Yeah.
can be a pretty serious and sometimes deadly form of pneumonia.
That's right. And the discovery of Legionella pneumophila was another turning point in our understanding of atypical pneumonia,
For sure.
especially because it was found in water sources.
So you're telling me you could get pneumonia from contaminated water? Exactly. Outbreaks can occur in places like hotels, hospitals, or even cruise ships if their water systems aren't properly maintained. This really shifted the focus toward environmental factors in the spread of atypical pneumonia.
Oh, wow. So it's not just about person-to-person transmission anymore.
Right.
We have to consider the environment as well. So now we have three major suspects: Mycoplasma pneumonia,
Yes.
mainly affecting younger adults;
Right.
chlamydia pneumonia, more common in older adults; and Legionella pneumophila, which poses a threat to, well, anyone, especially those with weaker immune systems.
Yeah.
But hold on, you mentioned zoonotic pathogens earlier.
Yes.
Does that mean atypical pneumonia can also be spread from animals?
You're absolutely right. Atypical pneumonia isn't just limited to human-to-human transmission or lurking in water systems. Sometimes it can jump from animals to humans.
Oh, interesting.
Chlamydia psittaci, for instance, is spread by birds, especially parrots, and it causes a disease called psittacosis. And then there's Coxiella burnetii, which causes Q fever and can be transmitted from cattle, sheep, and goats.
So atypical pneumonia can come from all directions. Other people, contaminated water, and even animals. It's like a medical mystery with clues scattered everywhere.
Yeah.
But let's go back to those bacterial culprits themselves. You mentioned Mycoplasma pneumonia is particularly sneaky, right?
Oh, yes. Mycoplasma pneumonia is a master of disguise. It can actually change its surface proteins to evade our immune system,
Oh, wow.
making it harder for our bodies to recognize and fight it off.
So it's really good at hiding from our defenses.
Very good.
No wonder it can spread so easily, especially in close quarters like college dorms or military barracks.
Right.
But speaking of fighting back, how did doctors even begin to treat atypical pneumonia back when they didn't have the usual weapons like penicillin?
Well, in the early days, it was a lot of trial and error.
Really?
Doctors had to rely on their clinical judgment and
Yeah.
observe how patients responded to different treatments.
So a bit of a guessing game then.
In a way, yes. However, a major breakthrough came with the discovery of tetracyclines. These antibiotics proved effective against atypical pneumonia because they could target the unique mechanisms of these pathogens.
Ah, so tetracyclines were a game changer in the fight against atypical pneumonia.
Yes, they were.
But what about today? What are the go-to treatments now that we understand these pathogens better?
Tetracyclines are still used, particularly doxycycline,
Okay.
but we also have macrolides like azithromycin and clarithromycin.
Right.
And for severe cases or infections caused by Legionella pneumophila, we can use respiratory fluoroquinolones.
So it seems like we've come a long way from the days of Eaton's agent and the penicillin puzzle.
Absolutely.
But there's still one question that's been bugging me. If atypical pneumonia is caused by bacteria, just like typical pneumonia,
Right.
why are the symptoms often milder? What makes it the walking version?
That's an excellent question. And the answer lies in how these atypical bacteria interact with our bodies. For instance, Mycoplasma pneumonia often triggers a less intense inflammatory response in the lungs
Okay.
compared to typical pneumonia bacteria.
So less inflammation, less severe symptoms? That makes sense. But I'm guessing it's not always a walk in the park, right?
You're right. Atypical pneumonia can still pose serious risks, especially for infants and older adults.
So age plays a role.
Yes,
Is it because their immune systems aren't as robust as those of healthy adults?
exactly. Infants' immune systems are still learning,
Right.
like a brand new computer program that needs updates and fine-tuning.
Okay.
They're more vulnerable to infections because their defenses aren't fully developed.
So they're more susceptible to those nasty bugs. What about older adults? What makes them more vulnerable?
Well, as we age, our immune system doesn't function as effectively as it used to. It's a natural process called immunosenescence. Think of it like a veteran soldier. Still brave, but maybe not as quick on their feet as they once were.
That's a great analogy. So their defenses aren't as strong, making them more susceptible to complications.
Precisely. But it's not just age. Atypical pneumonia can also present challenges in cases where people have underlying health conditions. Remember that case study we discussed earlier? The woman with recurrent skin abscesses caused by Mycoplasma pneumonia?
Yes, the one with the autoimmune disorders.
Yes.
It seems like her existing health issues made her more susceptible to unusual presentations of atypical pneumonia.
Exactly. When the immune system is already battling other problems, it's less equipped to handle additional challenges.
Right.
It's like fighting a war on multiple fronts. Your resources are stretched thin,
Yeah.
and it's harder to defend against every attack.
That makes perfect sense. So we've established that age and overall health play a significant role in how our bodies respond to atypical pneumonia. Are there any other factors that can influence the severity of this walking illness?
Absolutely. And those are some of the things that we can explore further in our next segment.
Great. Well, we'll be back soon to continue our deep dive into atypical pneumonia. Stay tuned.
Looking forward to it.
We're back on our deep dive into atypical pneumonia. And, before the break, we were talking about how age and underlying health conditions can make someone more susceptible to complications from this illness.
Right.
But there's more to the story, isn't there?
There is, and it has to do with something called the host's immune response.
Okay.
It's like
Yeah.
this kind of delicate dance between our bodies and these invading pathogens.
Mm.
Sometimes the dance is smooth, the infection resolves quickly. Other times, things can get a little bit more complicated.
Okay, break down this dance for me a little bit more.
Sure.
How does our immune response actually affect the course of atypical pneumonia?
Well, you can think of our immune system as this really complex security system
Right.
with various layers of defense.
Okay.
So when these atypical pneumonia bacteria invade, our body's first responders, things like the white blood cells,
Right.
they rush to the scene to try and fight them off. And this battle, it can trigger inflammation, which
Okay.
is essentially the body's way of trying to contain and eliminate the infection.
So inflammation is like the alarm bells going off,
Yeah,
signaling that there's an intruder.
that's a good way to put it. Now, in most cases of atypical pneumonia, this inflammatory response is relatively controlled,
Right.
which is why the symptoms are often milder.
Okay.
But sometimes the immune system's response can be a bit overzealous,
Okay.
and that's when things can take a turn for the worse.
So it's like the security system going haywire,
Exactly.
causing more damage than the actual intruder.
Exactly. And in some instances, this excessive inflammation can actually lead to a condition called acute respiratory distress syndrome, or ARDS.
ARDS. That sounds serious. What is that?
It is serious. ARDS is a life-threatening condition where fluid builds up in the lungs,
Oh, wow.
making it very difficult to breathe. And it can occur when the immune system's response to the infection goes into overdrive,
Okay.
causing this widespread inflammation in the lungs.
So in these cases, it's not just the bacteria themselves that are the problem.
Right.
It's also the body's own immune response that's actually contributing to the damage.
Exactly. And this highlights the complexity of atypical pneumonia. It's not always a straightforward case of bacteria versus the immune system.
Right.
Sometimes the immune system's attempt to fight off the infection can actually backfire.
So it's like walking a tightrope.
Yes.
You need the immune system to fight off the infection, but you also need to make sure it doesn't overreact and cause more harm than good.
Right.
Are there any other ways that this delicate dance between the immune system and atypical pneumonia bacteria can kind of go off the rails?
Well, sometimes the infection can spread beyond the lungs to other parts of the body.
Okay.
We call these extrapulmonary complications.
Extrapulmonary. So the bacteria are like little escape artists.
Yeah.
Breaking out of the lungs and causing trouble elsewhere.
Yeah, that's a good way to visualize it. Mycoplasma pneumonia in particular has been linked to various extrapulmonary complications, ranging from skin rashes and joint pain to even neurological problems like encephalitis
Wow.
and even heart inflammation.
That is a pretty wide range of potential problems.
Yeah, it is.
How do these bacteria manage to cause so much trouble outside of the lungs?
It's not always fully understood,
Yeah.
but it's thought to involve a combination of factors.
Yeah.
In some cases, the bacteria themselves can directly invade other organs.
Oh, what?
While in other instances, it's the immune system's overzealous response that's actually causing the damage.
So it's kind of a double whammy.
Yeah.
The bacteria themselves causing trouble and the immune system sometimes overreacting and causing collateral damage.
Exactly. And this underscores why early diagnosis and appropriate treatment are so crucial in managing atypical pneumonia. The sooner we can identify the culprit and start targeted treatment, the better the chances of preventing these complications.
This has been so insightful, this whole deep dive, really shedding light on the complexity of atypical pneumonia.
It is complex.
It's not just a simple cough and cold.
Right.
It's a multifaceted illness with the potential for some really serious consequences.
Right.
But as we delve deeper into this medical mystery, I'm curious, how has our understanding of atypical pneumonia changed the way we approach its treatment and prevention?
That is a great question, and it's one that I think we can really unpack in our next segment.
Okay, we'll be right back after a short break to continue our deep dive into atypical pneumonia. Welcome back to our deep dive into atypical pneumonia. It's been quite a journey exploring the history of this illness, unmasking those sneaky bacterial culprits, and learning about how our own immune systems can actually play a role in how severely we experience it.
It really has.
But now I'm curious to hear more about how all this knowledge that we've gained about atypical pneumonia has changed the way doctors approach treating and preventing it.
You're right, we've come a long way since the early days of grappling with this illness.
I bet.
Back then, treatment was largely a guessing game because doctors didn't even know what was causing atypical pneumonia.
Yeah, they were kind of flying blind, weren't they?
They really were.
Just observing patients and seeing how they responded to different medications.
Exactly. But once scientists identified those key pathogens behind atypical pneumonia, like Mycoplasma pneumonia, Chlamydia pneumonia, and Legionella pneumophila,
Right.
they could finally start developing more targeted treatments.
It makes sense, to actually go from fighting a shadow to being able to see your opponent and then plan your attack accordingly.
Yeah.
So what are some of the go-to treatments for atypical pneumonia today?
Well, we now have a whole range of antibiotics that are effective against these bacteria. Tetracyclines, particularly doxycycline, are still commonly used,
Okay.
as are macrolides like azithromycin and clarithromycin.
Right.
And then for severe cases or infections caused by Legionella pneumophila, we can use respiratory fluoroquinolones.
So it's like having a whole toolkit of different weapons to use depending on which specific bacteria is causing the trouble.
Exactly. And the good news is that with better diagnostic tools, we can identify the culprit much more quickly and accurately these days.
That's got to make a huge difference.
It does. It means we can get patients started on the most appropriate treatment much sooner, which can really improve their outcomes.
That's fantastic. So we've got the treatment side of things covered, but what about prevention? Have there been any big advancements in preventing atypical pneumonia in the first place?
Well, prevention is always the best medicine, right? And luckily, there are some simple yet effective things we can do to lower the risk.
Like what?
Things like practicing good hand hygiene, covering our mouths and noses when we cough or sneeze,
Right.
and avoiding close contact with people who are sick.
Those are great reminders.
Ah.
It's amazing how such basic precautions can actually make a huge difference in protecting ourselves and others. But what about vaccines? Are there any vaccines out there that can protect against atypical pneumonia?
While there isn't a vaccine for all causes of atypical pneumonia just yet, there is a vaccine for pneumococcal pneumonia, which is caused by Streptococcus pneumonia. And this vaccine is highly recommended for infants, young children, and older adults because they're the ones who are more vulnerable to developing serious complications from pneumonia.
So even though there isn't a specific vaccine for every type of atypical pneumonia, getting the pneumococcal vaccine can still offer some level of protection,
Yeah, exactly.
especially for those who are at higher risk.
That's right. And it's also worth noting that researchers are always hard at work developing new vaccines for other causes of atypical pneumonia. So there's hope that in the future,
That's great.
we'll have even more tools to help prevent this illness entirely.
That's fantastic news.
Yeah.
Well, I think we've covered a lot of ground today, haven't we? From those early days of mystery and uncertainty surrounding atypical pneumonia to where we are now with more knowledge, better tools, and just a deeper understanding of this really complex illness.
Absolutely. And it really speaks to the power of scientific inquiry and the dedication of healthcare professionals who are constantly striving to unravel these mysteries of disease and improve the lives of their patients.
And even though we've come a long way, the journey's not over yet. There's always more to learn, more to discover, and I have a feeling that even more effective treatments and preventive measures are on the horizon.
I agree. It's an ongoing process.
Well, that's a great note to end on. This deep dive into atypical pneumonia has been fascinating. Thanks for joining us, and be sure to tune in to our next episode, where we'll delve into another captivating topic in the world of medicine and health.
See you then.